Hi everyone, happy Wednesday and welcome to the Conversation Project Community Call. My name is Naomi Fedna. I'm the project coordinator for the Conversation Project, and I hope everyone's having a great week. I'm going to be your WebEx host for the day, and before we get started and dive right in, I'm going to go over a few WebEx tips and tricks because the platform can sometimes be a little bit tricky. So if you have a question or comment at any point during the call, feel free to type it into the chat box at the bottom of your screen and send it to all participants. And in that same drop-down menu, you can click Host and send any message that you want to direct to me, specifically questions about any technical issues or more information or resources you may want me to send to you. You can also use the raise your hand icon, which is located on the right-hand side, and we'll call on you to voice your questions or voice any concerns or comments that you have. So today on our call, Patty Webster is going to be leading the presentation. Like I said, I'm the project coordinator. And Rosemary Lloyd, TCP's advisor to faith communities, is also on the call and will be in the chat if you have any questions that you want to direct to her. So before we dive right in and before I pass it over to Patty, we want to know where everybody is calling from. So to get a sense of where everyone is located, please point to where you're calling from on the map. To do this, use the arrow key in the upper left-hand corner on your screen, right above the WebEx presentation you're currently viewing. Click the arrow key and then click on the map where you're located. Great. Well, we have people calling from all over California, Delaware, Georgia, Texas. I'm currently in Illinois. Great. It seems like we have a great group with us today. And Patty, I'm going to pass the ball over to you, and you can take it away.
Great. Great. Thank you, Naomi. And can you hear me okay?
Yep, I can hear you.
Super. So welcome, everybody. As Naomi said, we're just excited to have you here, especially given that it is summertime. Where I am in Arlington, Virginia, is hot and sticky. I'm seeing Tanya in Hawaii, and I'm a little jealous because you've got the beach. I don't have any beach near me. But we really are excited to have you guys on the call, given that it's challenging to get everybody during the summertime. And I just am really thrilled because this Community 201 call is our first foray in creating an opportunity for those that have been doing this for a little bit longer and for those that haven't to learn a little bit from those that have been doing it longer. And just to talk through some of the issues that we're facing, talk about how to sustain this work and keeping the momentum. So this is kind of a test run for us. We're hoping that you all will help us think through ways to make this call even better next time. So we're thrilled to have you here. Before I get into the agenda, we've got a really great lineup with Jackie Dinterman, and I'll introduce her a little bit more in detail later. But before we get into that and the discussion throughout this with everybody, because we're going to open it up, just want to go over a few things with you all. So today is our community call. We have a series, if you're not already aware of all of our different community calls, we have some coming up. I just want to quickly point you to. In August, we'll have a call coming up on our Conversation Sabbath, and we're excited to have Rosemary here with us, who is our advisor to our faith communities. This is going to be a really interactive, exciting call to help launch the Conversation Project that's happening this fall. We'll have a virtual speaker training, so a train the trainer, so to speak. If you're looking if you've been doing this for a while, you may not necessarily need this, but for those that want to learn tricks on bringing this to your community, we've got some tips and tricks for that. In October, we're excited to have a call to help prepare for Alzheimer's Disease Awareness Month, which is in November. We'll highlight some groups that are working on that, and we'll get later in the call, I'm going to ask you some thoughts on how to help us formulate this call and an additional new lineup that we have coming in November. A call on ensuring equity. So we really want to ensure that this work reaches everybody, and we're reaching diverse communities that may not necessarily be reached through the regular means. So we hope that you guys can have some ideas and help formulate these upcoming calls in this fall. So with that, the only other thing I'm going to jump into before I introduce Jackie is some updates. We are really excited to share some new and revised resources that we have I'm going to take you to actually our website to where this is. We've gotten some phenomenal feedback from you all, from our community groups, and we always ask for feedback at the end of these calls, so hopefully you'll stick around and continue to provide that. You guys have been telling us that our resource page may need a little bit of work, and we definitely recognize that. So what we did is we listened to you, and we've revised our resources page, and we're now calling that Get Involved, and I'll show you that in a minute. Along with that, we have created a new conversation champion map, and we're super excited because we've heard that you all want to see who else is doing this work, whether it's in your own state or whether it's in your own focus. So if you're working with faith communities, we've heard you want to connect with others that are working with faith communities. So we created this champion map to help you find each other. And so I'm going to go to I'm going to share my desktop with you all. Naomi, can you just confirm that you guys can see this?
Yep, I can see it.
Awesome, super. I'm sorry for those that are calling and you may not be able to see this, but I'll walk you through it. I went to theconversationproject.org. I'm sure many of you are familiar with our website. On our homepage, you'll see it looks exactly the same, but the tab on the far right used to be our resource center. It is now called Get Involved because we know that you all are really getting involved in your own communities. So we created this specifically for you to kind of revise it a little bit. If you click on this Get Involved tab, it takes you to this page here. And what we've done is we've segmented out our resources for you to segment them into healthcare, faith, and community. So a little bit of targeted resources to help you find it a little bit faster. I'm not going to go through those, but I encourage you to click on them, explore. This page is live right now. We haven't yet promoted it because we have, as you scroll down, we've got some other things we're testing out. We've got the newsletter sign up all on one page. The community calls are all here, so it's real easy for folks to sign up. And as I mentioned before, we're testing out this Conversation Champions map. So here is the map. You'll see it has a few of our champions already populated on it. And we're hoping that you all here on the phone will get your names up there and join this map so you can find each other. So when we promote this in August, you'll be on there, and if you, as you go through this and if you recognize any or see any kinks, give us some feedback, and so we'll have some time to work those out. You click Apply here, and it'll take you to a page where you pop your information in. And after you apply, your pin will be put on the map. So I'm going to click on this here just to give a quick example. This is our community in Boulder. So this is the Conversation Project, one of our community members, many community members. Constance Holden is our contact here. So you'll see you can put your contact name. If your project or your work has a title, you can put that in. If you're with an organization, you can put that in. The instructions walk you through this pretty clearly, we think. And here you provide a description of what you're doing, and this will help people find you. To actually help people find you even further, so those are the descriptions. As we get more pins, you can go down here and search by zip code if you want to get real detailed on it within your state, and you're looking for specific people within your zip code. If you're looking for people within your state, just type the state name in. Any keywords, you can go in there. And this is all color-coded. So the purple are our community organizations, the blue designate healthcare organizations, and the orange designates faith organizations. So you can tag yourself what may be best for you. So we're really excited for this, and we hope that you'll explore. We hope this is really useful for you. So any feedback you have on that, please let us know. I'm going to go back to our presentation now. The only other thing I want to talk about is hopefully you all have received some emails. You may have received a few emails. We are in the process of collecting some really important impact data from our communities, and it's our quarterly community activity survey. It is still open, and if you've filled that out, I want to thank you because this information is really helpful for us to see what you're doing out there. If you haven't had a chance to fill it out right now, Naomi has gracefully put this over in the chat box. So if you see there's a link right here in your chat box to this survey, we really hope those that are either using TCP resources or if you've been influenced by our work, have gotten some ideas, joined some calls, we'd love for you to fill this out. ask about your activities that you've been doing over the last quarter, but even if you haven't held any events or done any activities, there is a question there that we'd love to get feedback from you on what audiences and how you're reaching new audiences. So if you click on that link that Naomi provided, it will take you to a tab. If you click on that now, you can have that tab open, and once you're done with this call, you can conveniently fill out the survey. So thank you so much, and we're excited to now jump into the meat of our call. I'm going to give you a quick rundown here. So for the next hour, for the next 15 minutes, we're going to start with our community highlight, and we're really excited to have Jackie Dinterman with us, who's going to share a bit about what's going on in Frederick County, Maryland, and specifically with her healthcare system, Frederick Regional Health System. We're going to have a little bit of Q&A with Jackie once she gives us some background on what the work they're doing, talk a little bit about how they're sustaining momentum, and we really want you all to feel like you can ask questions, insert comments at any time. So during all of this, please, I encourage you to jump over to the chat box, pop in any comments or thoughts that you have. This is really interactive. We really hope that you are feel free to interact throughout the whole webinar. After we have a little Q&A with Jackie, we're going to just open it up to some group discussion because we really want to hear from those on the call to hear how you're keeping this fresh, sustaining momentum, and learn about the new audiences that you may be reaching as you've been doing this for a little while. And just kind of hear about your pain points and what things are maybe top of your mind. And then we'll wrap it up and just talk a little bit about the future calls and see if this works for you, and we hope to have this call designed by you guys in the future. So with that, before we jump into Jackie, I'm going to ask you, just so we know who's on the call, test out the chat function a little bit. If you can pop in the chat, we've seen where you guys are on the map, but real quickly, if you could just pop in, let us know where you are again, what your focus area may be. So if you're working with the general community, pop that in. If you're working specifically in healthcare, put that in, or if there's another one, faith or any other. And then just give us an idea of how long you've been doing this work. So when I say this work, meaning spreading conversations and helping others understand the importance of end-of-life conversations in your community. So go ahead and pop that in, and that'll give us a good idea of the spectrum of who's on the call. So this is great. So I'm seeing that we've got folks that have 5 to 10 years. It's wonderful. A couple healthcare folks here that are on the call. Bob and Ruth Ann, I'm excited to hear you're in healthcare. You've been doing this for a long time, so I'm excited to hear some of your thoughts as the call progresses. I see a lot of healthcare focused here. So 3 years in Anne Arundel, welcome, excited to see you guys. Vidant Health System, that's great, welcome Mary Lou. Let's see, Jen is working in hospice and palliative care, so 16 months sharing the conversation project, great. So you've been doing this for a little over a year. I see Lori Miller. Lori, it's great to have you. I'm loving to see all these familiar faces and a lot of new faces on the phone. So Lori's been doing this for about 3.5 years in Dallas. Great, so this is giving us a good idea, and we'll give Jackie also a good idea of where people are coming from. So we've got a mix of those in healthcare, community-based nonprofit. This is where Kat is. This is wonderful. So thank you guys. Keep putting this in, and I'm going to scan this and see who else is on the line. This will help each other. And if you have questions for each other, go ahead and feel free to pop that into the chat, as Naomi mentioned. Okay, so without further ado, I'm going to introduce Jackie. We are super fortunate to have Jackie Dinterman with us. She is the manager of care management, as I mentioned, at Frederick Regional Healthcare System in Frederick, Maryland, so around the corner from where I am. Jackie's responsible in her day job for the daily operations of all the activities and programs related to care management. And she's been really instrumental in building partnerships outside of the healthcare system with nursing homes, assisted living facilities, but really out within the community setting, and has brought that model out. And so she's here to share a little bit about what they're doing with the community today. I want to say Jackie took on this initiative that she'll share about end-of-life conversations without any other funding or staff. So this is pretty much on top of her full-time day job at the hospital. So this is just a huge testament of her passion for this. So Jackie, welcome. I'm really excited to have you here with us, and I'll go ahead and let you share a little bit of background of the work you're doing.
Thank you so much, Patty and Naomi. I really appreciate you having me here today. It's great to see the website changes. That's so exciting. I always thought you all had such an amazing website anyway, and all the things that have been added to it is amazing. I just wanted to tell you a little bit about our initiative that started back about 3 years ago now, back in 2015. We were asked to provide education to our community about advance directives, and I thought at the time, I'm not really sure how this is going to go over and how people would be accepting of this, but I use the title now, Igniting the Conversation in Our Hospital and Our Community, because looking back, we really did ignite the conversation and have ignited the conversation. The community, the hospital, everybody it's really buzzing about advanced care planning. So it's been really exciting to be a part of that and watch the change. We started with this, we all knew in our hospital that, you know, when we, the Healthcare Self-Care Determination Act, I think it was back in 1991, when they asked us to ask patients about advance directives and to educate them on that when they came into the hospital. We were doing that very well. We asked the patient if they had one, we handed them an advance directive, but we really weren't doing much with it afterwards. No one was really sitting down and having a thorough conversation with the patients so that they could understand what they were completing. So we had about, just back when we started in 2015, we had a 1% completion rate for advance directives, which we really thought that we could do better than that. And then also our CEO of the hospital went to a conference and came back from that and had heard about what was going, a little bit about La Crosse, Wisconsin, and that 96% of their patients have an advance directive when they die. And he wanted to find out, you know, how is that happening? What are they doing that more patients are completing advance directives? At the same time, everything was happening with readmissions, and we were looking at our readmission rate and trying to figure out why many of our patients were coming back within 30 days. And there was a high amount of patients coming back with the team that was looking at the charts. They were coming back with needs for palliative care, or why didn't we address hospice with the patient, or why didn't the patient have an advance directive, and no one was having those conversations. And while we were looking at that, we realized that when patients are coming into the hospital and during a medical crisis, and they don't even understand the terms that we're talking about many times. So we thought that we, you know, really could take the information out to the community so that they were hearing these terms ahead of time before they even came into the hospital. When they're in the middle of a crisis, you know, they're not feeling well. You know, they don't want to talk about these things at that time, but if they hear about them ahead of time, we thought that would make a difference. Family members are making decisions for their loved ones when they haven't even had a discussion possibly with their loved one about their end-of-life decisions. And we were getting in the middle of a lot of ethical situations because there's a lot of family disagreements, and one family member would have heard what mom wanted a different way than the other one. So those were sort of the things that made this a need for change. But most importantly, we are blessed, I'm blessed with a senior leadership that knew that it was really the right thing to do for our patients and our community. So we had that plus that we started out with. And then I know that maybe some other settings and other healthcare areas, you know, facilities may not have. But so with that, we did what we do best in healthcare. We formed a committee, and we were very cognizant that taking this out into the community from a hospital, people may wonder, you know, why is the hospital pushing conversations about an end-of-life care, or why are they pushing us to complete advance directives or trying to educate us on that? So we really wanted to include our community partners, multidisciplinary team within the hospital, but also our community partners, so they could help guide us as to how to share this message with everyone. There were a lot of different things that we were seeing in our research, different ideas that people were doing to spread the message, but we wanted to see what would really work well most in our community. So the goal of the committee was to provide education and awareness to our Frederick County residents regarding the importance of communicating personal wishes for end-of-life care. We also wanted to make sure that we were providing tools and resources to our individuals, caregivers, healthcare providers to help encourage these conversations, because not only are our patients and our community members having a hard time having these conversations, our healthcare providers are as well. At the same time, we wanted to provide more understanding about palliative versus hospice care. We had to do a lot of education with our own healthcare providers as well. So we started out with just being asked to do something for National Healthcare Decisions Day, but as we talked about this more, we ended up we decided we would have 10 events per year, doing community education, outreach, things in the media. So we decided to form a work group, and this was the most essential part of what I think of our success, was the work group that we formed. It's changed a little bit and has grown a little bit in the past 3 years, but we have such a passionate and engaged group of people from the very beginning, and then some people have added on, that I think that's been the most successful thing that we've done. I do highlight in red Rachel Mandel and Jim Grissom, who were our physician champions within the hospital setting, and they worked with our providers in the hospital setting, because that was one of our our biggest issues with getting the physicians on board, with being able to have these conversations, not only just in the hospital, but in the community. Michelle Ross, I highlight her because I did all of this work when we first started, went out and did all the community events, coordinated all of the meetings and different things that we were working on. But she started in this role back in 2017, and she's the one that has taken our vision on and has helped really sustain our program. We have Hospice of Frederick County, we have nursing homes, we have assisted living facilities. We have the Frederick Center, which is our LGBT community resource center. We have on the committee a director of cultural awareness, and she's also over our Bridges program, which is our faith-based program that we provide education to lay health educators in the community, and they take those programs out and provide them to their organizations and congregations. One important point is to really have a good community member that gives you feedback, so that they can tell us what they feel is going to be accepted in the community. We had our Goals of Care navigators that came on board since we started this a few years ago. Department of Aging, they were very instrumental. We had a community attorney who partnered up with us early on because they were providing a pro bono event on Law Day and became engaged with us. So all of those people are very essential. The most essential people for me, because I had no planning experience, so if you're somebody that's starting out with this and you have no experience with planning events, our marketing people and then our people that have done planning events in our community that was on our working group were essential to me. They were just my lifeline, and they helped us plan the different events and know what we really needed, to provide to people. I use this is the one from the old website, but I use this slide because this is near and dear to my heart, because in the early stages of this was my lifeline, this is my inspiration, this is my go-to website, and it really literally saved my life back then, because I was doing this along with my care management role in the hospital, and I did not have time to develop any education, didn't have time to develop PowerPoints, resources, tools, and they had everything on the Conversation Project website. I don't think I've even been through every single thing that is on that website. They have videos that we included in our PowerPoints. They have different documents that you can use, and you can even add your logo to them. It's all on there. If you just go there and have the time to look, I'm not sure. We would never have had this project without their support. When we started out our initiative back in 2015, we did just the National Healthcare Decisions Day events. We did a lunch and learn for our hospital team, a community event, physician CME. But as we went on, the feedback and experience that we had was so great that we decided to have 10 per year. And it took a lot of time at first to really get the word out and to get people to let us come and listen to them, but it really took off very quickly, and we couldn't keep up back then, and we still can't keep up now. But we started out our first year with, we did our first Bridges cohort, which is our faith-based lay health educators program. We went to nursing homes, assisted livings. Independent livings were great. We had a lot of people attending the independent living events. We also wanted to make sure that we weren't just spreading the word amongst the older or the senior population or people with chronic illnesses, but Advance Directives are for anybody over the age of 18. And so we wanted to make sure that we were including our younger population. So we went to universities, and our Bridges program also had the younger population, health fairs, Pride Day, even a motorcycle club asked us to come and present at their motorcycle club. They had been at one of our community events and asked us to come to their event. So we wanted to start out that first year with doing 10 events, and that first year we had so many people ask us to attend events. We ended up doing 31 events that first year. And in the past 3 years to date, we've done 164 events for education. And we've touched approximately 13,450 people in our outreach and our events. We've reached 100,000 households in our Well Aware magazine. We've done 6 articles in the last 3 years, but we've also had articles in our Frederick News Post and some other different publications. We received a grant to purchase our red magnetic folder, and I'll talk about that initiative in a few minutes. We've developed Your Life, Your Plan logo and materials, which took a lot of time because we wanted to make sure we were sharing the right message. We've done a lot of education in the last 2 to 3 years with education from our interpreters for our committee and from our diversity department to learn a little bit more about approaching diverse populations. And we have, a really great diverse team on our work group, but we needed to hear a little bit more education. So in our second and third year, we really focused on reaching out to these more diverse populations. We developed an ambassador and facilitator program because we just couldn't manage all of the events that we were being asked to do. We used to just do one event down at Department of Aging, but now our advanced care planning social worker, Michelle Ross, is going to Department of Aging every 3 months. So she hits all of the senior centers every 3 months in our community and does education and actually takes the time to complete Advance Directives with them if they choose to do that. And I had mentioned, Michelle, in 2017, we did get the support from senior leadership to hire a full-time advanced care planning social worker to coordinate our events, but also help with completion of Advance Directives and MOLS forms within our organization. We did have our first National Healthcare Decisions Day proclamation in April, and Asian American Center and our Hospice of Frederick County just received a grant so that they can also partner with us to go out and provide education and tools and things like that to our community. And then I just found the Getting Started guide for congregations online, so we're adding that to our Bridges Lay Health Educators program in the fall. So that's pretty exciting to be able to add that. This is just a couple flyers just to give you an idea of what our community events have entailed, what the flyers look like. Having somebody on our committee from marketing was just so vital because they know what kind of pictures to use. We've done our health fairs, and we've done one of the things that we did this year for the first time was to offer wellness points to our employees if they sat down and had a conversation about completing an advance directive, and then they got more points if they actually completed the advance directive. They also got points if they had already completed their advance directive. We did a really great how do your colleagues have the conversation. It was a panel with our physicians during one of their Friday CMEs, and that was very successful with physicians actually being very transparent about how to have these conversations. One of our Hospice of Frederick County also, one thing that I learned from all of you being on these calls was that some people were doing events that included a play or a skit about advanced care planning, and I thought I could not, I just didn't have the time to even wrap myself or my thoughts around how to do that. And our Hospice of Frederick County took that on, and they did an event that we, provided materials for, and they had, I think, 300 people attend that event, and that's just exciting to be able to have all the people on our committee that has all the different ideas and the ability to be able to help with those things. This past year, during National Healthcare Decisions Day, we did a lot more on our social media, on our Frederick Memorial Hospital Facebook website and on Twitter. And the Conversation Project provides those little vignettes that we were able to put on there, so we didn't have to come up with all of those things. This is just an example of when we started out with our health fairs and things like that. I have to be transparent and share some lessons learned. When we started this, I had no experience with event planning or health fairs or anything, so I took, my little pack of Advance Directives, and I'm not even sure if I had like a little basket of candy at that time to draw people over to my table, but I went on my way, and it was really sort of sad and pathetic when you looked at all of the people that had their big displays. Some people had themes for their tables. It was amazing. It was very embarrassing for me, but it was amazing for them. And so I had to learn a little bit more about, how to make our table attractive and what kind of giveaways that we can give. One of the things that's in this picture is our Advanced Care Planning banner, Your Life, Your Plan. And that draws people over a little bit more to be able to find out what this is really all about. So just learning those little things along the way as to what you need to add to your table. And luckily, this was our most recent health fair, and we have quite a few more things for our table than we used to. But what's been really exciting about the health fairs is that when we started out with this back in 2015, I think the majority of the people, probably 95% of the people that came up to our table, didn't have an advance directive. Many of them didn't even know what an advance directive was. They just had no idea what we were talking about, and some of them didn't even come by our table. They just saw what it was, or they would just say, we would say about advance directives, and they'd go on their way and really not want any material. This past year, I would say 5% of the people that stopped by was not aware of what advance directives were, but I think probably 90 to 95% of the people either had an advance directive, they knew what it was, they had seen our materials, or they were coming to get more materials for their family members or their friends, or they had a friend with them and said, you need to pick up one of these red folders, this is what I told you about. So that was so exciting to see the difference of just 3 years and to see that, you really can make an impact. We don't really have time to go over any of our presentation today, but I just wanted to have a list here for you of some of the things. Depending on the amount of time that we have, we include videos, we include key definitions, we go over the starter kits, we break out into groups if we have time, and talk about ways to break the ice, to give them ideas, because sometimes people, if you just give them a few sentences to start the conversation, it does make it a lot easier for them. We go over the difference between palliative versus hospice care. We have a personal testimonial where someone talks about how having an advance directive really impacted their loved one's, life at the end, very much at the end. This is one of the tools, Patty and Naomi had asked me to provide some of the tools that we used, definitely all the Conversation Project tools, but I wanted for our state of Maryland, we have several different healthcare forms that people get very confused about. So we developed this little handout that describes the different forms and so that people would understand them a little bit better. We also provide in all of our packets the Advanced Care Planning Checklist. We realized early on that we were talking about all these different things, but when people go home, do they really have a list of things so that they know that they're following through with everything? So we developed this Advanced Care Planning Checklist. We also developed a one-page document, this is the front and back, of we had a packet that we were handing out with a lot of different things in it, and it was costing some money. So we thought, for some of the things that we know that someone doesn't need all of that information, maybe a certain event that we're going to or a health fair or something like that, we thought just to really keep costs down a little bit, our Advanced Care Planning social worker, Michelle Ross, developed this document. It's a one-page document that pulled all of the important things in together for us. Our Red Folder initiative has been one of probably the most successful things that we've done. One of our community social workers in our Care Transitions Department is Nicole Wetzel. She developed this idea of having this red folder. It's something that you can't see through, and it's magnetized on the back so someone can put it on their side of the refrigerator or the front of the refrigerator. And We also have educated our EMS. They're very engaged with this. They actually take folders out now to the people in the community, and they're looking for the folder. And it has their advance directive. They can put their MOLST form in there, an updated medication list, a recent photo, list of their physicians. So that's been extremely successful. One of the other things that we try to keep things fresh, we keep trying to find more ideas, because as we were doing all these different community events, we didn't want to keep doing the same things over and over again when people were inviting us back. So one of the things that we found online was the Hello game. And I think it used to be called the Gift of Grace or something like that. And we tried this at one of our events, and I was scared to death that everybody was just sort of going to sit there and look at each other. It's a game where you have a list of questions. What song would you want to be played at your funeral? Or if you're not able to go to the bathroom today, who would you call on to be your caregiver to take you to the bathroom? It's just a bunch of different questions that sort of really gets everybody involved in having the conversations. And it was one of the best experiences that I've ever had. People were laughing. There were some tears. There was a mother and daughter that was there, and they were sharing some things that were just beautiful. We broke out into different groups of tables, and one of the things someone had brought up was about taking care of her pet, and somebody else from another table said, oh my gosh, I never even thought of that. So it really does get the conversation started. Another thing that we found along the way that was very eye-opening for me, I've always tried to use anything that I'm using out for education in the community, I've tried to use for myself and my family and had the discussions with my family. But this proxy quiz that we found on the Commission on Law and Aging, and it's just a quiz. It's 10 questions that how I did it was, it's the same questions. I had the list of questions, and then I gave my husband the same list of questions. I answered the list of questions as I would answer them in those situations, and then my husband answered them as he thought I would want in that situation. And then we compared our answers and talked about it a little bit. And he's an EMT, and I'm in healthcare, and we thought we had really covered it all when you have different healthcare situations, but we hadn't. And there were two of the questions he didn't realize how I felt about. So it was really eye-opening for us, and then we switched it, and he did it, and it was really eye-opening what we came up with. So that was a really important tool that I think we use in almost every one of our educations. Another thing from the IHI and the Conversation Project, this on the Conversation Project website, is the Medicare reimbursement facts that they provide. This has been a great tool. Our physicians really perk up when we provide this in their education. The other thing, to the other side, the Coalition to Transform Advanced Care, we started getting different businesses were asking us to come and speak with them, and I was just sort of at a loss as to, really what to present to them other than our regular thing. And I went on the Conversation Project website, and here they had this section for different businesses and checklists for employers and things like that. So they've just been a lifesaver. And then just briefly, I wanted to talk about, as part of this whole initiative, we were getting so many people from the community completing their advance directives and sending them to the hospital. But at the same time, we wanted to make sure that we had a higher increase of patients completing their advance directive while they were in the hospital. So we took a page from the Gunderson Health System where they had facilitators, trained facilitators, that will be able to have that hour-long conversation with the patient and several time conversations sometimes with the patient to talk about these things. So we did a pilot with one of our care transition social workers, and just briefly, you'll have the slides, but we did a pilot, and as part of that pilot, and I really hate to talk about data and money and all of that when you're talking about advanced care planning, but in healthcare, it really is, part of life. So we really did, even though our CEO was very supportive of this and really started the conversation about having an advanced care planning initiative, we still had to show that, we could make an impact and show some outcomes and improvement. And so if you're from an agency in the community or a volunteer in the community and you're trying to figure out how to spread the word more and you're trying to engage with your hospital, bring up readmissions, like how you can help reduce readmissions. That will be, I think, what sort of spurs hospitals on when they're looking at patients coming in and out of hospital within 30 days, at least in Maryland, I know they are. So you'll see that we looked at patients who did an advance directive with this social worker while they were in the hospital, 6 months pre-hospitalization, and then their outcomes 6 months post-hospitalization. And then the control group was patients that did not complete an advance directive. And as you can see, there was a 60-cent reduction in total charges for those patients that completed an advance directive, and there was only a 39% reduction for patients that did not have an advance directive. Also, there was a significant decrease in readmission rate for these populations of patients. We looked at the impact of advance directive on our hospice use because we had a very low length of stay in hospice. Patients were coming into the hospital and they just didn't get to have the resources that our hospice can provide. So it really increased patients being in hospice longer and getting those resources. We saw a significant decrease in our SNF readmission rate, and we worked very closely with our nursing homes on this initiative. So it really all came together where it counts, at the bedside, definitely in our community. And with these outcomes, our senior leadership did support hiring a full-time advanced care planning social worker. And so as time has gone on, she has a 45% advance directive completion rate, which is above the national average, which is great. We increased the number of patients who have advance directives when they die. It's up to 41% now. We started out at 17%. We have a long way to go from what La Crosse, Wisconsin has, but we'll get there. Our readmission rate currently continues to remain low, and then so we feel that it's been very successful having this additional person. I know for me, who was doing most of the education and presentations and developing the presentations, it's been a godsend having her. So just some of the pearls and pitfalls of the past 3 years. When I think back, the time factor has been hard, but because everybody has been so engaged and passionate, there really have not been a lot of lessons learned other than some technical things that I'll talk about in a minute. But I think our keys to success, if I had to say, it would be having that multidisciplinary team, committee, having a diverse committee, having senior leadership support. You know, trying to talk senior leadership into this would be very difficult, I think, if you're not able to show some outcomes or do a pilot or something. But having the Conversation Project community calls has been the biggest key to success, because I've learned from all of you guys that have been on the calls, and Patty and her team. That's where we get the ideas from. And our committee and our advanced care planning social worker have been amazing. I mean, they have ideas on top of ideas. It's hard to keep up with all their ideas sometimes, and it's wonderful. So just be open to new ideas and what people come up with and what you hear on these calls, and just take a sort of day by day, step by step kind of thing is the only guidance I can give you as far as what we did, just because you can only do so much when you're doing other things. The lessons learned, really make sure, I think I've said it before, you need someone with event planning experience. Be ready to take your show on the road, because I had never really taken a PowerPoint presentation outside of the hospital, and I learned very quickly that you need to add a video onto your flash drive to add it it's already embedded in your presentation, but I had no idea that you have to add that to your flash drive. Those kinds of things were the main lessons I learned along the way, just because I had never done some of those things. So I think with you, you know, surround yourself with people that know those kinds of things. That's really more helpful than anything, and people that know about how to have health fairs. One of the things that I just happened to see out of the corner of my eye is about taking this out to our congregations. This has really flourished in our community with our Bridges program. We started out our Bridges program for faith-based organizations and congregations, and it's been so exciting every cohort we do to see this group of people as they graduate, because we give them the documents, we give them the tools, we give them the packets. We provide, if they would like us to, we can come and speak to, you know, their members. We provide whatever they need, but we provide them the tools to do the education themselves if they would like. So, any questions?
Great. Jackie, this has been fabulous. And I'm just going to give people a chance. If there's any other questions, please go ahead and pop that into the chat right now. This has been such great learning. I know we could really spend a couple hours with you and all the great things that you've done. You've shared a lot about ensuring there's a variety of tools to use. I think what some of my takeaways on keeping this fresh, how do you keep this going? And I'm going to ask you a follow-up question on that. But we've heard your variety on different tools to reach different types of learning and populations, which is important. Your collaborative nature, I think, is key. In the different groups have different strengths, so play on those strengths, and that also helps free up your time and resources. And I love that you have talked about learning from each other. So this community, other communities, you learn, and hopefully that's what we're helping to facilitate that cross-learning, and it sounds like that's helping it keep it fresh for you. If anybody else has questions, pop it in. I know Kathy Ahern-Gould had asked if we can potentially share that checklist that you had, that tool. Would that be something that you could make available to folks?
Which one is it?
That's the advanced care checklist that people can take home, and what are the steps that you need to take.
Yeah, I can provide whatever
tools.
Anybody needs. I can provide anything that yeah, absolutely.
Super, thank you. And Carla asked what the population is that you're serving.
We have all populations. I'm trying to look at the questions here. I'll just answer your questions. We are across the whole population in the community. So when things slow down and we're not getting as many requests for events, we're looking at what populations do we want to get out to and how can we do that. And that's where we talk about that in the committee and the best way to do that. So the populations are, I'm sorry, go ahead.
Go ahead.
So we've, talked with people, we've talked with younger people in universities, all the way to any age, really, seniors, just all the list of different community agencies, different groups.
So, Jackie, tell me, I'm going to ask one question, then I'd like to open it up and just hear from other folks and hear what other groups are doing to kind of keep it fresh, sustain momentum. So the question I have for you is, you've done so much, and you have talked about, your community knows, they recognize the work and that you're doing. How have you guys been able to, or what are your plans moving forward to kind of keep this fresh and sustain momentum? So you talk about, we often talk about reaching those low-hanging fruit, those that are really primed for this. How have you all, and what do you plan to do to reach those more resistant or, so to speak, death adverse? I hate to use that term, but how are you, what are some of those thoughts to reach out to those who haven't been reached yet and keep it going? Because we know that multiple touch points with those that are doing it. We know conversations don't necessarily happen after the first touch point. So what are some of the things that you're doing to kind of reach out to hard to reach or new audiences?
I think having the people in the committee has been really helpful. The Asian American Center reaches out to a lot of the different diverse populations. Just recently, we talked with someone in the deaf community, and so we are planning just this week, we're starting to plan something for the deaf community, which we wanted to do for the last 3 years. So that all of the different things that we started out with wanting to do, it just takes some time. That as we started out with the easiest populations, and then now we're sort of trying to get to the other populations. The one thing that I really learned from was talking with our interpreters when they talked about the different cultures and how some cultures, no matter how you approach it, this is just something in their culture that, like, I think one of the cultures, they don't make those decisions, that their, that their children make the decision, and if they're an older adult, and so that they just wouldn't make that decision themselves. So just learning those things was really helpful for us and how to approach it. But I do think that getting in with some of these groups, it's because we've had diverse people on our work group.
Great. Thank you so much. Jackie, thank you so much for sharing. I'm going to open it up a little bit to the group, and you have given us such a great jump start on some of the questions that we have for you all who are on the call. I know there's been a good number that have been doing this for a while. Some are just here to learn. So I'm going to pose this question, and as you think about this yourself, I'd like you to just pop it into chat. If you'd like to jump in and share with us verbally, we've got a little hand-raising tool if I can find it. Feel free to raise your hand. And so the question I'd like to just pose out to you all is, how have you shifted the way that you're approaching this work? And I think about that in two ways. So what kind of activities are you doing to kind of keep it fresh, to kind of sustain that momentum in your community? And then as we asked Jackie, who? So what are you doing to reach new audiences, or what are you thinking about to reach some of those hard to reach audiences that we just asked about Jackie? So if you all can pop in, think about that. I'd love, if anybody has some thoughts on that, pop it in the chat. As you're doing that, I'd love to just, Naomi, can you pop Rosemary in? I'd love to just have Rosemary, who's our advisor to faith, pop in and just offer some of her thoughts and reflections, if possible, while we're waiting for folks to chat in. Rosemary, are you there? Naomi, are you able to unmute Rosemary?
I'm going to give it a shot.
Thank you. And if not, we'll just keep going. Actually, here we go. I can do it. Or I'm going to try.
Can you hear me now?
Rosemary, are you there? Yes, this is great.
Great, thanks. Hi, everybody. Jackie, thanks for a fabulous presentation.
Thank you.
It's just kind of amazing what people like you, you're a force of nature, are making this happen and building your team to support you. So that's so fantastic. So I was just thinking about the group in Colorado, Patty, where Constance Holden is one of the leads there. And they've been doing work with the Conversation Project for about 5 years. And in the beginning, one of their key pieces was to get out into the community, into independent living situations, into congregations, into libraries, and lead a conversation starter workshop using our tools. And that was great, and it worked well, and they wanted to be doing new and different things along the way. And one of the things I saw that they were doing just this past year, I loved. It was totally different. They had the starter kits available for people, but what they did was a movie series, and they did it in partnership with some other faith communities, but not at the faith communities. They did it in partnership with the library. So there's a set of films that were shown at the library, advertised through these various faith communities and the wider community. So they had lots of partners and lots of different, diverse conversation facilitators after the movie happened. So they did this over a series of 5 weeks, and it was apparently very well received.
That's wonderful. Thank you so much. And there's so many wonderful examples of what next. And I think that's what kind of resonates. I see that Valerie Lehman here has shared a little bit about that kind of what next question. So she says last fiscal year, their big focus was on having community events. And the metrics were counting number of events and number of participants, which is great, Valerie. Hopefully you can help fill out our community survey too. They encountered a lot of interest, but that question of, okay, well now what? So she says that now they're pulling together an ACP committee to focus on health system processes for taking patients, for talking to patients about advanced directives and documenting them. This is a great tip and a great idea, Valerie. So I just hope you continue to share the learning with us, because as Jackie mentioned, we're all learning together. I'm conscious of time, but I do want to see if I could pull in one more. Lori Miller, I see Lori's here. Lori, if you're interested in sharing a teeny bit of just quick hit, how have you all kept it fresh? I know you guys have been working at the next level in your group. Lori, are you there? And would you be willing to share just a quick hit on how you're keeping it fresh?
Sure. Can you hear me?
Yeah, I can. Go ahead, Lori.
Okay, great. Thanks. Jackie, that was awesome. In addition to that. So we started, you're welcome. We started Conversation Ready North Texas, and we had our inaugural meeting last week. And what we really wanted to do is, I was getting lots of questions about what's going on next here in the Dallas area, and there was not a place where everyone could go to one all-encompassing place to find out what was going on. So we really want to be kind of an umbrella for all the good work that we have going on here and be very collaborative in nature, almost like what we're doing today, but in person locally. And as a matter of fact, Kendra, who's on the call right now, her Coalition for Quality End-of-Life Care, they were represented there. They're in Fort Worth, but they're doing such incredible work. We wanted everyone in Dallas to see what they were doing. So in our first meeting, we had about 45 or 50 mainly professionals, a few community volunteers. But it was hospice, it was hospital, Alzheimer's Association, and some other associations were there, home care, home health, care managers, faith communities were there, and it was really great. And we just felt that we would be a stronger voice altogether. Everyone's doing their own thing and everyone's individual, but we just thought we could share from each other. You know, it's all collaborative, nothing competitive. So there's multiple people in the same discipline, but just really share what's going on. Like I can go back and take all this information we learned today back to the group and just really make a big difference. And that's really pretty much the goal. We had a few speakers. There's some big stuff going on in Texas, in Austin, with our HHS, and he was a speaker that we patched him in through Austin and told everybody what's going to be going on soon throughout Texas. We had a large hospital talk about their what they do with advanced care planning, just to show other hospitals. And we had a community activist who's been very big in the Unitarian Church and has done incredible work through a couple of churches that way. So I was really pleased that we had such a good turnout. We have a website if anyone wants to go see it. It's Conversation Ready NTX, and we just kind of want to be a mini conversation project and just make it easier for everybody to find out what's going on.
Great. Lori, thank you. I think it's exciting to hear the diversity in groups that are joining and ways that people are so collaborative. I think this, for me, has been one of the most collaborative bits of work that I've ever seen. So I appreciate your sharing. I'm just conscious of time, and I just want to kind of wrap up our discussion a little bit, but just want to point out there's been some great sharing on chat. Hillary was noting Hillary Hotman, and thank you so much for sharing this, a little bit about what they did at a family camp last week, and talked about engaging folks from 20 to 80 in all different ages, using Go Wish cards, using Conversation Project. What I love is that there is no one tool or one way to reach folks, and there's so many out there, and so it's exciting to hear how people are using all the different tools that are at their disposal. Hillary, thank you for sharing, and I just encourage everyone to just keep in touch with the chat. We're going to send out the chat to everybody, so if you haven't seen it and you haven't had a chance to see what people are doing, we'll make sure you get that. So I recognize that there is so much that we could talk about. An hour is not enough, but unfortunately an hour is all we had today. So this is just some lessons for us. For the next time we do a call like this, we are hoping to get some feedback from you guys, because this is, as I mentioned before, a little bit of a test run for us. We want to hear from folks and think about what can we do at the next level. So thank you for sharing in the chat. We're going to ask for a little bit of feedback at the end to see how we can make this better. I just want to do a quick reminder. I mentioned the calls that we have coming up at the beginning of this call. I just want to point out these two last calls. We have the one in October and the one in November. It's really to highlight what's happening in the community focused on Alzheimer's and dementia. And then the one in November is focusing on reaching diverse communities. I would love if anybody has thoughts on how we can make those calls really helpful for you. Please go ahead and type it in the chat button. You can always email me at pwebster@ihi.org, and I'll make sure to get that out to everybody, my email. We'd love to hear from you to figure out what would resonate with you, and what are some of the questions you're grappling with that we can think about as we design these calls, because we really want to co-design this with you. So I'm really excited to have you guys share some ideas with us, either over chat now or follow up through email. So without further ado, I want to just kind of wrap up this call and just let you know, I know there's a lot of folks on the call here. I see that Mickey Jackson has shared some of what they're doing. I'm excited that you're here, Mickey. She's been doing some great work with Peace Health out in the West Coast. And I just want to say thanks for everybody for joining this. As I mentioned, we'd love your feedback, so if you can just stay on, you're going to be directed after this. When you click out, you'll be directed to a quick survey on how we can make this call in the future better. So please definitely give us feedback, just a few questions. And then don't forget, just go back to that tab that you opened up earlier. If you haven't yet filled out the community activity survey, we'd love to get your feedback on that one. It shouldn't take more than 5 minutes. And for those of you that have filled it out, I really, really appreciate it. So I just want to thank Jackie again. There is so much going on. You have an incredible amount of collaborators and impact on the community that you're working with there in Frederick. So thank you so much.
Thank you.
And thank you all for joining, I'm sure. And thank you for joining, and we hope to see you at our next call. Thanks all.
Mm-hmm. Mm-hmm. Perfect. Yeah. Dinterman. Mm-hmm. Yeah, that's a good idea. Yeah, well, she's taking Kate's place in the community called the Happen Monthly, but she's our improvement advisor, so she works a lot on like different improvement strategies, quality improvement, and evaluation, like implementing evaluations and learning into TCP's framework. And so she's a part of our team. She's been with our team for a while now, but she's taking over for Kate in the presentation role. Yeah. Yeah. Right.